The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Little Miracles, Cheryl's bone marrow transplant and Sarah's recovery from brain surgery. 5-year-old Cheryl has leukemia. She will soon receive a bone marrow transplant.
We're going underground. Okay.
Cheryl's 12-year-old brother Shokri will donate his bone marrow with the hope of saving his sister. To keep Cheryl clear of infection, she will have to be in isolation for at least 3 to 5 weeks.
This is our regular isolation room.
You know what my room is filled with on the behind you? Donations.
Cheryl has had intensive chemo and radiation therapy for months. Nothing has worked. Her last hope is her brother's bone marrow.
And one there, within a balloon.
She loves the balloons.
And there are their footprints.
You always pull it toward the teeth.
I caught one!
After I wake up and if there's like soreness or anything, they're gonna give me a medicine or something.
You bet.
Through an IV.
Probably not. They might give it to you orally or through an IV, but definitely something to help you feel more comfortable. Have you been told anything about what to expect tomorrow?
Well, yeah, they said that the doctor. I talked to another doctor before, and he said that I might have a choice of whether to get a IV or something.
That's right.
For the anesthetic.
Yes.
And when I wake up, I might have some soreness or something.
Yeah. That's pretty accurate. You will end up on the 4th floor. I will be there with something very special for you because you're doing an amazing thing. And I would say within 1 day or 2 days, you'll be up and running.
Okay.
Now, if there's one thing that I want you to take away from today, it's what I'm going to be telling you in the next few minutes, okay? You know that your sister has what we would call a life-threatening illness. Okay. And you understand that she needs to have a transplant in order to survive.
Yeah.
Okay. What I want you to remember is that even though the bone marrow is a perfect match, that sometimes the disease comes back. And sometimes the actual transplant doesn't work. So if there's one thing I want to make so clear to you, is that if things don't work out and your sister is still sick, that it doesn't have to do with you. Do you have any questions about that?
Okay. Not really.
Okay.
13-year-old Sarah suffers from devastating epileptic seizures. She has had her brain mapped to locate the trouble spots.
Hi, Sarah. How are you? You see me a little bit with that left eye? Tomorrow we will plan to remove the part of the brain that's causing your seizures. We have a great chance to make you seizure-free. How does that sound?
Okay.
Thumbs up, son. That's great. The one thing, though, when we take away the part of the brain called the occipital part, that will affect your vision off to the side.
So when I'm 16, I could drive a car?
We will wait for the eye doctors to check your eyes, and then we'll be able to tell if you have enough vision to be able to drive.
But just in their daily life, the kids seem to accommodate very easily to that kind of neglect on the left side.
I'm still optimistic. I still think that everything would be okay. And so far, Sarah has been responding very good. And everybody's praying for Sarah. And I know it will work out.
Today, Sarah will have a portion of her brain removed to hopefully stop her epilepsy.
Okay, team, how's it going? Good?
It's going well, yep.
We have the template. Oh, great.
So it looks to me like it comes right.
Yeah. There's some veins underneath there, so we'll explore that. Good, 125.
Okay, 2 next to it is 24.
24.
While she's isolated, she'll only be able to see Mom and Dad. Just to review Cheryl's case, where we're at with Cheryl, you know that Cheryl has this AML, her acute myelogenous leukemia, That particular subtype of leukemia in childhood is very high risk. It's very hard to cure. Fortunately, Cheryl has Shokri, who has the same bone marrow type. So if we do a bone marrow transplant, first thing that it's important for you to know is that 3 out of 10 times this doesn't work. So this doesn't guarantee a cure. Sometimes the leukemia comes back anyways. Essentially, if transplant doesn't work, it's unlikely that anything will work. So if this doesn't work, it's not, the outlook is not good, okay? The second thing you need to know is that transplant procedures are very, very high risk. So when we do this, 1 out of 10 kids will not survive it. I think having gone over all of this, it sounds pretty depressing. You're thinking, it's not. The likelihood, though, is that these things will not happen. And the vast majority of kids who have a bone marrow transplant get through the transplant without significant bad effects. Once it's all over and done with, you usually couldn't pick them out of a crowd. They look healthy, and they live normal, healthy, happy lives. We'll do everything we can to make sure she gets the most effective treatment. We'll try and help her get through that as best we can. But whether it works or not is really beyond our control. That's in the hands of a higher power.
I think if you came straight down here, we'll do this like lobectomy first. This part's a little bit complicated back here, and if you try to take this out in one piece, you'll end up into the ventricle and have all sorts of problems.
And then start the maintenance in about 8 hours.
8 hours?
Yeah. We have put down all the numbers and letters on the brain so we know exactly where hand is and where sensation is that we talked about yesterday, and then we put down all these numbers so he knows what to take out, and this is all exactly where we thought it should be. So we know exactly where function is, so we can stay away from that, okay? And we'll put down electrodes and see if there's any seizure activity left, okay? She's doing fine, and he's starting the surgery right now. So I'll talk to you when we finish everything.
I'm gonna take some blood. Fill line with some saline.
Which one is ours?
They are egg sellers.
Just hydrating her tonight for her chemo tomorrow. We can take off her mask.
What we're going to do is tomorrow when you come in, you'll come in first thing in the morning. You go down to the operating room. They'll put you to sleep. Your blood pressure's normal. Then we put needles through the bone into the marrow cavity, and we pull out a little bit of marrow. We need about 500 milliliters of bone marrow from you. That will probably take about 50 or 100 pokes. The light is bright, but it won't damage your eyes. The effects will be gone in a couple of minutes. You look great. This is going to be a piece of cake. I'll bet your little sister is very thankful to have a big brother like you.
Okay, Brian. Why don't you put it in? I think you'll be okay. Now, I just want to get this out. The rest of this goes to 6611. Okay. And then this is going to pathology here.
She's doing fine. And we're finished. Dr. Rutka's now closing. So what we said we were going to do was take the temporal lobe and the occipital lobe. There was a little bit of brain left underneath here, which I asked Dr. Rutka to go ahead and take because a lot of the seizures are coming from this area and I didn't want to take the chance of bleeding anything. So he took this whole thing and he took all of this. So as we speak, there's no seizure activity coming from anywhere in the brain. So we'll just have to see what happens. So we've done all we can do. I was encouraged that the EEG looked so good everywhere.
Yes, the horse is right there. Hey, you. How are you? We will be turning down the lights.
And could you draw that curtain as well?
Okay, here we go. Remember to keep your eyes open.
So do you want a picture for you and a picture for our wall?
This one for the wall.
Or this one for you guys? Did that one work? That one worked.
Hi.
How are you?
Okay.
Sarah, look who's here. Mom and Dad are here.
Hello, Sarah.
She's doing great.
Yeah.
She's just waking up a little bit.
Yeah.
She's moving her hands and feet for us, which is wonderful. Sarah. She likes to sleep. You like to sleep? Funny?
Hi, Shokri.
Yes.
Hi, did I pronounce that correctly?
Yes.
I'm Dr. Carsey with anesthesia. Just been looking through this. Sounds like you're entirely healthy. Is that true?
Yeah.
You're 12 years old?
Yeah.
Have you ever had an anesthetic before or an operation before? No. Is there any family history of problems with anesthesia on either side, mom or dad?
As I remember it all.
Who you're donating to?
My sister.
Your sister. That's a nice present, isn't it, from Big Brother? If you don't like IVs, we'll give you a mask. And we have bubblegum masks, we have watermelon masks, and strawberry masks. Do you like any of those? Which one?
Watermelon.
Watermelon it is. Okay, so we'll give you a watermelon mask. You can hold it yourself, okay? And it's laughing gas, it's giggly gas. You start feeling nice and giggly. And then you won't even feel the IV going in, okay? It's good. We'll see you in there soon.
Okay.
Okay, thanks.
Thanks.
So you okay? Watermelon.
How would we like to do this? Small volumes, large
About 5 ml can. I mean, we've got a big donor. So this will go from here to blood bank. If blood bank needs to do anything in terms of taking off plasma or red cells, they'll do that. And then the product will go straight upstairs.
Hello.
Hi, Sarah. How are you?
I'm okay. Just here hurts because it's swollen.
No seizures or anything? No. Good. The hair is coming back quickly.
Oh, don't talk about that.
Squeeze my fingers.
Tight. Good girl.
Okay, look at my nose. How many fingers?
I don't see.
Okay, and now?
2.
2. Okay. Look at my nose. You see here, right? How many?
2.
And here? You don't see until I come
2.
this way. So half of the world on this side, you're not seeing too good. But it's gonna get better. You know it's from your surgery.
He's awake. He's a little dizzy right now.
she told me.
I told him that he'll be here for about another half an hour, and then he'll be going upstairs.
You can't open your eyes? You have to open your eyes. Okay, you don't have to open your eyes. Just relax.
So they removed the occipital and temporal lobe, and then she developed double vision when she awoke from the anesthetic. Is that it? Is that what you noticed? Are you keeping your eyes closed now, your right eye closed now because you have to, or just to avoid the double vision? To avoid the double vision.
Mm-hmm.
I see. Just look at my pencil tip right here, would you? Watch it come over here, all the way over. Look up here, up. Look over here, look down.
When I look up with this eye, it hurts.
Okay. I'd like you to tell me when you see the blue part of the pencil coming from the side. Say yes when you see it.
Yes.
Let's do this.
Yes. Yes.
Well, your daughter does have reason to have double vision. Her eyes are not straight, as you can see yourself, I'm sure. One is pointing off to the side, This came on after the operation, so presumably it's due to some upheaval, you know, within the brain of immediately following surgery, and I'm hopeful that this would clear as everything else improves, as the swelling from the operation goes down.
When she look at me, I can see that it's a little bit off.
Yes.
And,
I can't predict if it will go away completely. If it doesn't go away completely, then we have to think of glasses with prisms, or possibly even eye muscle surgery. One of the things I didn't mention inside was the fact that she's not seeing well to her left side. Are you aware of that?
Yes.
You are aware of that, okay. The degree of visual loss she has there is quite severe. She has no light perception at all to the left-hand side. In other words, she's not able to see light right from the center to the side in each eye. It's the same. Unfortunately, it's probably a permanent state of affairs. That has certain implications we can talk about at a later time, if you like, in terms of her education and her ability to do things as an adult.
Oh, he won.
How are you feeling?
A little dizzy.
A little dizzy? Are you feeling a little sore?
A little bit.
Did everything go as we talked about yesterday? Well, remember how yesterday I told you that I was going to be bringing by a special something to kind of commemorate the event because you've done a wonderful thing. Do you know the game Battleship?
Yeah.
This is for you. And this is a certificate that we make for each and every sibling donor who donates bone marrow. So this says that the Hospital for Sick Children Bone Marrow Transplant Unit supports and recognizes you. You're very welcome. Still feeling a bit dizzy? Yeah. Well, you know that you just have to ask for anything you want, okay?
Yep.
All right.
No, I'm sorry.
good. We're gonna just make sure you're feeling everything in your legs, okay?
Like what you do with my hand and neck.
Exactly. So just relax your leg. Good.
I can't see.
You can't see it?
Would you like it? I get 5 points first.
What? You get 5 points first? No way, Jose. Oh my goodness, what am I up against? Now, do you want to take a step forward?
No.
Okay, it's pretty far.
You gotta respect
her. No, how is that? And watch how I'm going to come down. Okay? One step, then the other. Okay, can you try that instead? Good. Now how does that feel? Does it still hurt your knee? No? Okay. Now let's walk back to the bench.
I'll put Love Sarah in...
Just Sarah.
Okay, purple.
Here.
Hi, Sarah. How are you?
Hi.
Hey, I like your patch. That's fantastic. Let's see this.
That's for you.
Oh, I'm going to read this out loud. Can I?
Yeah.
It says, Dear Dr. Rutka, thank you for giving me the opportunity to get over my seizures and to feel like a bird. Okay.
Free like a bird.
Love, Sarah. Oh, that's wonderful. You know where this is going to go? Right in my office, right on the wall. I'll find a special place for it. So thank you so much. That's great. How are you feeling?
Good.
You've been doing all this work today? You must be feeling good. Look at the colors of this,
I'm
huh?
walking in the atrium and to the eye clinic.
Aren't you doing fantastic? Yeah, and you've been doing really well with your seizures. I know you had a couple of spells, but basically looks like your seizures
Flashes,
are just flashes.
Yeah.
So basically the seizures are much better.
But they're not worse like before.
Good.
Because the ones before used to scare me.
That's right. Yeah. Well, we don't want them to be scary for you now, so I'm a little concerned about the swelling, but basically it seems to be settling down, and hopefully we'll be able to send you home by the weekend.
Why anytime you hum it, I start singing it? And then you finish.
Sarah will go off her medications in 2 years. Only then will the surgery's success really be known. But for the first time in years, she is now leading a seizure-free life.
Cheryl will be going into a reverse isolation room after her bath that she takes prior to going in. She's going into room 5. We are about to enter the transplant room now after scrubbing in. Parents at this time cannot enter until they scrub in. We're now going to hook her up. Her marrow is infused by an electronic IV pump. We're currently waiting for the marrow to come up from the blood bank.
Yeah.
So you want to see your brothers one more last time because it's going to go into you soon, okay? See it? Just looks like blood almost, eh? Any questions before we start? Okay, Cheryl, we're going to be starting shortly.
On the next episode of Little Miracles, Cheryl's chance of survival, and Kareem gets a new kidney. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Cheryl's leukemia, and Kareem gets his mother's kidney. Two-year-old Kareem was born with almost no kidneys, and he's been on dialysis since birth. Miriam, his mother, is going to donate her kidney. Today, Kareem and Miriam will have their final tests before the kidney transplant.
Good job. There. Okay. There. Is Mommy going to do blood work too? Should Mommy cry too?
Yeah.
Okay, let's see. We have to go upstairs now. What time is that? It's 8. We're all done blood work. We need to go upstairs for a little bit, and then we're going to go and do an X-ray, okay?
Head back just a bit
Put your
more.
head back.
That's it.
Good job.
Good.
Mommy.
It's all right.
Okay, that's all now.
You want to put your hands straight? Okay, you can put them like that.
Head straight.
Your head straight?
Yeah.
It's almost done. I'll get you out as soon as you're done taking your picture, okay?
Okay. Ready here. Can you just step out while I take it? All right. Okay, I'm just going to turn you sideways, like that. Okay, almost done. Okay.
The children's hospital.
Mommy, can you put me?
Yeah, you're going to come out right now. Okay, hold my hands.
No.
It's time to come out. Are you all done being a horsey?
Yeah.
Okay, yay.
Yay. I'm moving.
The incision will be under your rib cage. It will be under the 12th rib on the left-hand side. Your incision will be probably more painful than your son's, just because of the fact that we cut the muscles that are involved in breathing, and so every time you breathe, it's going to hurt.
That'll be lots of fun, I'm sure, you know.
It's going to be uncomfortable, there's no question about that.
Yeah, lots and lots of pain medication. Okay, well, I think we're ready.
5-year-old Cheryl has leukemia. Chemo and radiation treatments have failed her. Her brother Shokri's bone marrow is a good match and will be donated to Cheryl once her own bone marrow has been eradicated.
Take good care of you. So you okay?
Cheryl is left with a severely weakened immune system. The slightest infection can be deadly. She must be in a sterile environment for several weeks. Only her parents can visit. Hopefully, the transplant will graft and create healthy blood cells. Cheryl cannot leave isolation until there are clear signs the grafting has worked. This bone marrow transplant is now Cheryl's only hope for survival.
Any questions before we start? Which one? Oh, it's out there. Okay. Okay, Cheryl, we're going to be starting shortly. If you feel funny in any way, you let us know, okay? If she does spike a fever, there's certain procedures that we do. We draw blood from her central line, and we also, on occasion, might need to poke from her arm. There's a certain course that they follow. They get a fever, they don't eat, they get mouth sores, they get diarrhea. Then eventually their counts come up. They're being stimulated in order for her marrow to engraft.
Went back to sleep again. He's so tired.
Depends if they get their medication ready or not.
Wake it up, Yellow. Wake it up. 2, 3, 4. Go.
There you go.
You wake up. Fin Sarah. Tarek Fin.
You still have to go to dialysis,
Tita, come and see.
I have to go to dialysis.
You have to go to dialysis?
Yeah.
Really?
Yeah.
Uh-oh. Are you ready to go? Okay, then let's get ready to go, Yella, to dialysis. Head and shoulders, knees and toes, knees and toes, knees and toes.
Head and shoulder, knees and Barney!
Yep, there's Barney on TV. Oh, hi there. Okay. Look who's here. Daddy's here.
He's a choker.
Say hi, Daddy.
Hi, Daddy!
Hi.
My dad.
How you doing, bud? My daddy is here.
Daddy.
So everything is okay on one schedule?
Yep, everything so far is so good. Lots and lots of blood work this morning. That was, even Kareem said, "Okay, cry, Mommy." Did you tell me that? No, you didn't. Did Mommy cry when she did blood work?
Yeah.
No, I didn't.
Mommy cried.
Okay, Cheryl, we are going to be finished. You will hear a beep, and that'll be it. You have received your brother's bone marrow. Feel different? Hey, you might even talk like your brother. What do you think? No? No way. There you go, my dear. You are now finished. The hard part's over now. We've got the marrow. Okay?
Let's
So,
hope and wait.
yes, exactly. We can just wish and hope and we wait.
Yeah.
Okay?
Okay, thank you so much.
You're welcome.
A child that's developing and progressing with chronic kidney failure has the potential to not develop mentally to their capacity. And that's a credit to all the people that worked here, is the fact that they were able to carry him through with all the dialysis, etc., and medical therapies, they were able to bring him to a level where he's comparable to any other 2-year-old. He had almost no kidneys at all. There are advantages to being off dialysis and to have a functioning kidney. There are great advantages. But there's also a lot of risk. And the one we dread the most is when we have a living related transplant. That is, one of the parents has made the sacrifice of undergoing surgery to donate one of their kidneys, and we have an unsuccessful outcome. And we don't like to talk about that, but we have to talk about that. Because we sort of not only need you to understand that A, it could happen, but B, is challenge you to think, how are you going to deal with it if it happens?
It's not really our place to be miserable and worried about things that we don't have or things that we can't do. It's best to just enjoy what we can do and what we do have. And I think that's going to help a lot. It helped us a lot throughout the process, throughout the past 2.5 years. And I think it will help us through any adversity that will come through.
I mean, I don't think it's anything we can dwell on. You know, if it doesn't go the way we want it to, and it does reject, or, you know, we'll just be back to where we were, you know, back at dialysis and until sort of the next step happens. You know.
Well, rejection is even you're shocked initially when it happens the first time, and it almost always happens. But rejection is manageable. Most of the time we can get rid of acute rejection and maybe have to deal with chronic rejection, which takes months and years. In the operating room, the time of removing the clamps, the unclamped time, is probably the most stressful time in the whole process. Because within a period of minutes,
you know,
the kidney pinks up and firms up and looks healthy. Everybody's celebrating. Whereas a kidney that stays floppy, soft, remains bluish, you feel your coronaries going into spasm. It happens in less than 10% of the time, but it happens.
Yeah, so the fevers that she's getting are pretty normal for being like 7 days after transplant, and until her counts start coming up, and maybe a while before the fevers go away.
I hope it goes away soon.
Yeah. Yes.
Please? We'll just take it and that's it. And
You just be quiet.
okay, we will be quiet, but just take it. Please?
If she still has a fever and they can't figure out what's growing in the cultures, then they'll probably start on amphotericin, which is a drug, the other drug that Angeli was talking about today. Yeah, so this is pretty typical, what we see in the kids. And until she gets, fevers go away and the counts start coming back, then it should be like this for a little while.
Can we take the medicine now, baby? You rested for a long time now. Come on. Please.
Show me what you can do, Cheryl. I'm going to leave them. Will you take it if I leave?
Okay. Promise?
Okay, good. I'm getting out of here.
Come on, sweetie. You're a good girl. I know you are. Everything will be okay, babe. Everything will be okay. Good girl. You want me to keep it here? A surprise for Daddy? Are you still coloring your feet?
I'm still coloring.
Anything to get you from starting to cry, right? You're all done at dialysis, yeah?
Dialysis is finished.
I'll say my goodbye now because I know you'll go back over to the floor and everything.
I'm okay.
Don't start me.
I'm trying.
I'll come and see you both Friday. And you're incredible.
Mommy, I colored on there.
Mommy's gonna color in a minute. Mommy's just happy.
Maybe we could borrow this and then we'll bring it back to dialysis. How does that sound? Can we take it with us to your room and you can play it in your room? Say bye, everybody.
Bye.
Bye, Kareem. Say bye, Mikesh. Thanks.
Cheryl! Hello, what are we doing? Playing Go Fish. Okay, so her white count this morning is 1.7.
Wow. Big jump from yesterday.
Yeah, it is a very big jump since, you know, the last week or so. Things are going well and, you know, hopefully by then, and then as long as she continues to eat, like probably in a week or two, she can go home.
Oh, this would be great.
Yeah.
Caroline is going home today.
Yeah. Yeah, see her, do you see her, sweetie?
Say hi to you. Caroline, she's going home. Hopefully tomorrow or after you'll do the same, honey. Yeah, Cheryl, say hi. Oh, I just hope that she maintains this count so she can come outside.
We'll keep our fingers crossed.
Okay.
Too sweet.
Well, these people made us get this far. So without you guys, we wouldn't be where we are, you know.
Exactly. Oh, that's very thoughtful. What a cutie.
Well, I don't know. We were just talking about that. I'm not sure whether he realized it. I mean, keep telling me he's going into the hospital. He's going to 6A. He's kind of, you know, he keeps asking when he's going to 6A. And he's been running around yelling, you know, I'm getting a new kidney, I'm getting a new kidney. But I don't think he really understands what it is, you know, that he's getting exactly, you know. So we'll see.
Wow, that's amazing.
Here.
You know what, Cheryl? We just called from downstairs, and they want you guys just to go down because the virologist is there to do his scraping. Yeah. So, but he said as soon as that's done, you guys can come right back up again. Okay?
Where is your Ivy? I can't hear you when you're drinking milk and talking to me.
Here it is.
Is it hiding? There it is. So what are you going to do tomorrow?
Oh, bath.
You're going to have a bath tomorrow? And then what? Are we going to go upstairs to the operating room? Yeah? And we're going to have an operation?
Maybe.
Maybe? And what are you going to get? Are you going to get a new what?
New kidney.
You're going to get a new kidney, that's right.
You'll be
Will you be okay?
Yeah. Yeah. The question is you.
Why won't I be okay?
I don't know.
I'm not going to get lopsided or anything because I only have one kidney. That's it.
So you're looking forward to days without dialysis?
I guess.
Without the trip?
Yes and no. I was telling them I think I'm going to miss this in a really strange way for all the wrong reasons, but I mean, it's become part of our life. Strangely enough, we've actually been able to make it part of our life. And
Yeah, so just a happy update that this was really a good transplant, a simple transplant we should call it. Yeah, so far so good, not major problems. I'm looking at discharge on Monday.
Monday.
Yes. All right. We will do the cytogenetic studies to check that she has a donor engraftment.
Okay.
All right? Okay.
Oh no, don't say a word.
No, I'm not going to say anything. You can dance. You're going to go home Monday? Huh?
Cheryl's bone marrow transplant is successful.
You put it in my pocket.
She can go home, where she must remain for 6 months until her blood counts fully stabilize. Only then can she return to senior kindergarten.
You're welcome. Bye-bye.
And I hope we come here just for this. Just for a visit.
Just a visit, yes. That's all you want to be here for, is a visit.
Be good, Cheryl.
Margaret will go down. I guess this is the best way.
Kareem, which way will we go?
He'll tell us which way to go.
We go this way?
Dr. Grace come to visit. Let's just put this in here.
Yes. Mommy's here. Mommy's going to come in.
I'm coming with you. Sweetheart.
You want Mommy to hold you? Would that be okay?
Okay. Cindy gonna help. I got you. Chair.
Why don't you sing the barn song? Okay. We're going to sneak back over to the other room.
Now this is scary walking in here. It sure is. It's a totally different experience. Okay. Put them back here.
Okay. This is just something to start making you feel a little bit happier about it all, okay?
A little cocktail.
Have it on here.
Have some pleasant dreams.
The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Kareem's new kidney and Robert's cranial reconstruction.
Look who's here.
2-year-old Kareem was born with almost no kidneys. He's been on dialysis since birth. Kareem's mother, Miriam, will donate one of her kidneys to him.
So everything is okay and on schedule?
Yep, everything so far so good.
No,
I didn't.
In the operating room, the time of removing the clamps, the unclamped time, is probably the most stressful time. The kidney pinks up and looks healthy. Everybody's celebrating. There's a kidney that remains bluish. You feel your coronaries going into spasm.
Miriam takes Kareem to his operating room. The surgery to remove Miriam's kidney will occur in a nearby room.
Now this is scary walking in here. It sure is.
Some pleasant dreams.
Kareem's Kareem's father and grandmother wait while Dr. Khoury prepares Kareem for his mother's kidney.
Where I'm pointing? And that's the area where we're going to put the kidney. That's where we're going to hook up the kidney, right in here. You can see it's nice and white. All packaged and ready to go.
It's okay, look. You can still see out.
18-month-old Robert was born with a misshapen head. The top suture of his skull has prematurely fused, so his growing brain is causing a head deformity. If not corrected now, Robert's head will continue to grow abnormally. Reconstructing his skull can fix the problem, but it's risky surgery. Robert's parents decide to proceed with the surgery so that he can lead a normal life.
And health-wise, he just has the allergy to clavulin and no other medical problems that you're aware of. No problems with his heart, his lungs, his liver, his kidneys that you've ever been told about?
No, he's a pretty healthy boy.
Just his head. Just his head. You are very cute. Yeah.
Sometimes.
He's always cute. Let me take a little listen. Is this cold? Let me warm it up. What's that? There we go.
Yeah. So I know we've gone through this before, but really to me the obvious deformity or problem is that his head is very long and it's also very narrow. This is just a plastic skull. But basically what it shows is that the different sutures or the different lines on between the different bones of the skull. And the one that's involved in Robert's case is this one called the sagittal suture. And because there is no sagittal suture, the growth that would normally occur like this has been prevented, and as a result, the brain's compensated by pushing front and back, so the skull has grown front and back. But essentially, the nature of the operation is to remove the area where the suture is, take the bones of the head off, and then reshape the head to give it a more pleasing shape. Although some people might consider it cosmetic surgery, I look at it as if it was a very functional operation in terms of giving him a pathway to develop and give him all the advantages. So the things that we worry about when we do this operation are something you've already been exposed to this morning, in that there's a blood loss problem. So the majority of these cases do need a blood transfusion. And the good news is that you're compatible, so we can use your blood. Occasionally, we need to give more blood on top of that. More than the 2 plants so far? Yeah. So I don't mean to scare you with all these nasty things, but it is something you need to be aware of, is that when we take the bone off the brain, sometimes there can be some tears of the lining of the brain, sometimes there can be some injuries to the blood vessels, which can make the bleeding problem a little worse. Our biggest concern is if he dies.
Yeah.
He was fine before, and we made a decision, he passes away.
Okay, can you put some traction on them? Let's go, guys. We're wasting too much time. We don't have that much time. Move the kidney over. Clamps are all off. How many minutes? Thank you. Now it's turning blue. This kidney I don't like. It's not as well perfused. It's not pink. No. This kidney's not perfusing well. We're not perfusing well, guys.
No.
For this to be over.
Hi, this is Robert. Dr. Carsey with anesthesia. I'm just going to kneel down. Okay. You know what kind of an operation this is. Our job is to take care of him during this. We monitor his heart, his lungs, his blood pressure, the oxygen in his blood. We make sure he's nice and asleep, nice and comfortable, okay? And we give him the fluids that he needs, which includes, probably for this operation, blood. Now you know what kind of an operation this is. This is not minor surgery. Once he's asleep, because of the nature of this operation, we're going to start another intravenous, a larger intravenous, and a special type of intravenous right in his wrist that can measure his blood pressure at all times. There is a good chance that he'll need a blood transfusion for this, okay? His starting hemoglobin is 125, that's a good start. But the nature of this operation, I've never seen one that hasn't needed a blood transfusion yet here, so expect that.
Going over to the recovery room. Watch that side of it.
Miriam's a very healthy kidney donor. Everything went fine.
Okay. Yeah, we're just going to give you a little bit of oxygen, okay?
Not perfusing well. And is ultrasound on their way?
Yes.
Can you ask them to hurry up a bit?
I told them right away.
Well, he's making urine. There is urine coming out. Seems to be. Let's see what the ultrasound shows. I mean, it's perfused. I think it's pinker now. That's the kind of picture. Sounds good to me. That looks good. Okay, let's hook up the ureter. No, I'm feeling better. I had spasms in my coronaries, and I don't need that. Okay, I'll go speak to Dad. Hi. Let's go slip the back. When we put the kidney in Kareem, it right away pinked up as soon as we took the clamps off, so it was great this way. And we had immediate urine output. And then as his blood pressure adjusted, it started turning a bit blue. And I said, oh. And we gave him more fluid, and then it pinked up again. And but it continued to produce urine all through. It never stopped. So it took maybe about half an hour, 45 minutes, where we were just sitting there watching it. But to reassure myself, I had the radiologist bring their ultrasound machine, and we did the Doppler study right there and then, which showed that the whole kidney was well perfused without difficulties. So
okay, good.
I'm happy.
Morning. Hi guys, how are you?
Not too bad. Still not too good.
No. This is a very difficult time, but everything's gonna be fine. We'll take real good care of him, and I'll come and find you afterwards. Great. Robert, are you ready? Are you ready? Maria? Yeah. It's okay. Where's the students?
They had the surgery a few days ago.
Yeah.
And they're happy for you to meet them if you want to meet them.
Oh, the same type of surgery? Oh, I'd love to.
Okay. Yeah. So he's just starting to open his eyes,
Just
right?
starting, yeah.
Well, that's good. I thought it was longer than 3 days.
I wish I could show you his before, how he looked, because we never even believed it could look this good.
I feel so bad though for them, eh?
They're never going to remember it.
Yeah.
And he'll thank you for his
Oh,
whole
yeah.
life. Yeah. For them here, it's routine. I mean, they do this so
so many times.
How's the blood pressure doing, Elaine?
There you go. Fairly quickly we'll have to call blood bank and have some ready ahead of time, right?
We're good.
Excellent. Just getting another one ready for you, okay?
Yeah.
Yeah. We're doing, well, still losing obviously, isn't he? Yeah, okay. We're on it.
And you have blood in the, you have blood in the room? No, it's just we're going to dissect under the sinus.
I have a okay, you guys may be dropping in pressure. You better let us know because we got some oozing here. We're going to let you get cut. It was a big bleeder right here.
Was it the sinus?
Yeah, it was a vein off the sinus.
We're going to hard him up.
Maybe a small piece of gel. It was squirting right at us, wasn't it? Bipolar on.
I'm in the... Happy to move now that's the manifold sense to get it right now. Thanks. We're running to the end of the donor blood.
Okay. The new blood in the room.
The new one is on its way, but not in the room.
في أدوية time sensitive. في أدوية لازم تديها.
Kareem, are you sore? I'll put this next to you, okay. Okay, we'll go to the intensive care.
You want to hold it?
I want to put it next to
Okay, all right.
Hello.
Hi, how are you?
Good, how are you?
Good. So you know Kareem is 2 years old, Kareem-Belly syndrome. He's had extensive surgery, and he had a living-related renal transplant. From mum came the kidney, and we just give him a bit of morphine now. He looks pretty comfortable and stable.
He does look fantastic.
He looks pretty good. He looks really good.
Lightning check here, okay? Yes. 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 361267. Yes. 361267. Good.
How are we doing over there, Kayla?
More blood's on its way.
So tired right now. No.
12:30, just to say everything's going along just fine. Everything's okay, and we're proceeding nicely.
Okay. Do you know when they'll be done?
No, they didn't say. They may call with another message later at some stage.
Well, 3 hours.
3 hours is like an eternity.
Everything now is just going to be a gradual. This is like usual, just like before.
Send off some coag.
Go along without the amount of blood that we lost on this child. Unfortunately, I think the anatomy of the sinus was such that it was right in the way of our osteotomy. So there was probably nothing that we could have done to avoid it, except not do the operation.
Hi.
Robert's doing very well. Dr. Forrester came and spoke to you, right?
Yes.
He's in the ICU now. He's asleep. He's nice and comfortable. Everything looks absolutely fine. From our perspective, everything went very, very well. But it was not entirely straightforward. The bleeding was significant. I think you already know that, right?
Yeah.
Much more than any of us thought. We gave him the 2 units that you donated up front, but we needed to give 5 more.
Oh my Lord.
Yeah. So much. We all know that they can bleed a lot from this, but even this was more than any of us thought.
When can we see him?
It takes a while to get things all sorted out. He's got several intravenous's. He's got lines coming all over the place, so they want to sort all of that out, Get him nice and comfortable first, so it'll be at least half an hour.
Okay. Amazing.
Okay, guys, thanks.
Thanks a lot.
Okay, bye.
They could have lost it.
Yep, he had the best doctors. It's just going to take time, that's all.
Oh, dude, my tooth.
So he woke up quite nicely as well.
Good.
I just had him always on a little bit of morphine, and he woke
Right.
up very nicely.
So right now, is he on morphine?
He is on a little
is.
bit, and he's also sitting up watching TV,
Okay.
and quite happy watching TV.
Oh, good,
So
good.
he looks quite good. And the kidney's working pretty well too, as you've probably heard.
Yes.
Yeah, it sort of started working within pretty much straight away, actually.
Great.
So,
Yeah, I'm hoping to get down to see him.
I'm going to look different standing up.
So I feel different standing up.
Hi there, how are you doing? Well, you're up. Good for you. I'm actually feeling a little bit better.
My mom's here.
Hi.
Hi, bud.
You know what?
Yep.
How you doing? Can I have a kiss? So, how's this jelly belly doing?
Fine.
Good.
I was waiting for you in the bed.
Were you? And then mommy came?
Yeah.
Good job.
Hi, everybody.
Hello.
Oh, nice balloons.
Oh yeah, tons of balloons.
Hi. I've just looked at his CT scan. I've gone through it with one of the radiologists, and as far as I can see, it looks perfectly normal. The head shape looks good. There's nothing to suggest any bleeding around the brain, which is one of the things that we would worry about. And he doesn't look irritable. He doesn't look sick. So I'm really thrilled with the way things have gone, all things considered.
I thought he'd be more swollen and bruised, but he's not. Well, they thought downstairs, they go, oh, he's already had the surgery? Because they just looked at him and good, because he doesn't look like he's had surgery. So.
Well, his head shape's improved, which is one good.
It has. Go to sleep.
I think we'll keep an eye on him tonight. We'll see how things are in terms of fluids. And it would be nice to get rid of the intravenous, and if everything's fine tomorrow, then I think we should send you home.
Great.
Mm-hmm.
Robert lost a liter of blood during his surgery and required extensive transfusion. But his recovery has been rapid, and after 5 days, he can return home.
Yeah, I need to sign my discharge form for me, Miriam Abdel Salam. The only adult on the floor, I think. There. Well, hello there. Did you have another IV?
Kareem has had a bad morning. Concerned about complications, his doctors order an ultrasound. There's a chance that Kareem is having kidney rejection.
I'm right here.
The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Mika's heart surgery and Kareem's new kidney. Two-year-old Kareem was born with kidney failure. He has been on dialysis since birth. Through a transplant, he received a new kidney from his mother, Miriam.
Flush.
Several days after surgery, there are complications. Kareem has too much fluid in his belly, and he's showing signs of kidney rejection. His discharge from hospital has been delayed. A biopsy will determine how serious the rejection is.
With the biopsy, sometimes we might have a little bit of bleeding.
Okay.
Usually we do get a bit of bleeding in the urine, and that's normal. So it's nothing to get excited about. And you understand that we're going to put a little needle in and take a bit of tissue out. And that tissue is going to go to pathology. They're going to look at it under microscope and tell us whether there's any signs of rejection or any other pathology.
Okay, sounds good. I guess nothing we can do. That's all right.
Okay. That's the best we have.
Yeah. Yeah.
Okay.
Hi. How you doing, big guy? Are you feeling good today? Yeah. Waiting for mommy? Yeah. Can I give you a hug? You okay? Do you want mommy to come with you?
Yeah.
Okay, mommy will come with you downstairs. Okay? But we have to get your gown on and change your diaper and be all ready for when they say it's time to go downstairs.
Six-year-old Mika arrives in Toronto from the Philippines with her aunt and her mother, Minda. She has a hole in her heart which could be life-threatening. She may need open-heart surgery to close the hole, an operation that's unavailable in the Philippines. The Herbie Fund, which assists children in need from other countries, has arranged for Mika to come to the Hospital for Sick Children in Toronto.
This is very big country. Iba ito eh. Hindi Manila ito, nako. This is Toronto. Different, no? So, my daughter is Solaki.
May bahay ka sa Manila? San Quezon City?
Hi, nice to meet you. Hi, honey. How are you? Hi, Mika. How are you doing? Did you have a good flight?
It's a very big hospital. Sorry? Very big hospital. Yes.
Hi. Mika? Mika, hi, Mika. Hi, I'm Dr. Nicolette. I'm the cardiologist. Hi, Mika. Can shake hands? There we go. Good. I'm one of the cardiologists here, and the doctors in the Philippines wrote to me initially, and I'm the person that they were writing to as we were going along. This is Mika's heart, okay? This is her left side, and her right side over here, and her head's up here, and her feet are down here. And these are the two pumping chambers of the heart, and that's where the hole is right now. And that's allowing blood to go from the left side into the right side. And that extra blood then goes off to Mika's lungs and then comes back, and it's making this side of her heart a little bit on the big side. Question then becomes now one of, do we need to do the operation or not? It makes me wonder what the risk of doing an operation is versus the risk of her having sort of a big heart as time goes on. That's why we're going to do this study, this test called a nuclear medicine angiogram. And what that's going to tell me is how much extra blood is going into the lungs. If that test comes back and tells me that there's not very much blood going into the lungs, in fact that there's a very little small amount,
then I don't think we need to do the operation. Okay, which would be very good, wouldn't it? That would be the best thing. I suspect that the test will come back saying that she probably still needs to have the operation because her heart looks big to me. So we'll wait for the results of that test, and then we can decide if we need to do an operation or not. Okay? Is that good news?
Yes. In fact, I'm really afraid of surgery.
Yeah.
Miss Molly?
Halika dito, Miss.
Daniel, not you, Daniel.
Where is the pizza? Here.
You know how to add now? Seven plus 7?
14.
You know also? 3 plus 6. Yeah, easy.
9.
5 plus 2.
7.
Contest. I know, the winner I will give you $1. I will give you $1.
One more.
Another. 2 plus 3.
5.
4 plus 5.
9.
Daniel, you're so smart, Mika? Are you smart girl?
Now the nurse will come out to get you in a few minutes. Yeah. You're gonna get a special picture, and then they're gonna put a special needle in your tummy when you're sleeping, and take a tiny, tiny piece of your kidney out so they can check it and see how your kidney's doing.
And then I'm gonna hold it?
No, you'll be sleeping. The doctors will get to hold it later.
Does Micah speak English?
Yes.
Hi, sweetie. I just need to take a little picture, okay? You come down here and I'll show you. I've got some special stickers right there. Come on down here. Come on in here, Micah. Oh, you're such a big girl. Now, Micah, can I get you to lay down here? Very good girl. 9 on your chest and your tickly. Boop. And I have one more down here, Mika, okay? One on each leg. There. Thank you. Now, Mika, you see these? See these little wires? Watch what I do with these. And see, every sticker has a little tail, and I just attach it to the little tail, just like that. Wonderful. Okay. Let's see what we have. There we go, and here it comes, a wonderful picture. Perfect. And it's done. We take this off. You want to see it? Look. Pretty neat, eh? That's your heartbeat every time it goes. You see here?
You can see all the big stuff.
Yep.
I don't wanna, Mommy.
Oh, Mom's gonna be right here too. And this is Danny. He's gonna be here with us as well.
Mommy, I don't wanna go now. I don't wanna go now.
You're not, oh, you know what?
You're gonna be okay.
You're gonna stay right here on your bed.
You're gonna stay on your bed for a little bit.
You're not going near that at all.
I don't wanna go now.
No, you're not. You're gonna stay right here on this
Stay right
bed.
here, okay? And we'll close the doors.
I don't wanna go in my bed.
Well, then we won't go on that bed, okay? Can we stay on this bed? Okay, then we'll stay on this bed.
On that finger so mommy can help hold your hand, okay?
Oh, there we go. And Mommy can help hold your hand there. Yeah.
That looks like a
That's
what?
And this, remember
It's like
the
a
big
car.
muscle test? This
What's
is
that?
the big muscle test to see how big your muscles are.
What is that?
Remember that? I think you've had this before.
I think you've had this before, right?
The main risks involved are to do with the actual bypass machine. And so being hooked to that bypass machine, we talked about the risks of blood transfusion. But there are two organs that don't like the way the bypass machine makes blood flow: the heart itself and also the brain. The heart doesn't like it just because it isn't receiving a normal blood supply, and sometimes after bypass it's a little bit slow to beat after. In terms of how the brain doesn't like it, a little bit of air can end up being sort of drawn into that tube, or sometimes even a small clot, so the blood can clump together inside that tube. If that clot goes up and travels to the brain, then basically that means the child can have a stroke after surgery. That's a devastating complication, but it does occur. It probably happens about 1 in 200 to 1 in 100 times after surgery, so it's very uncommon, but it does mean that they have permanent brain damage, can have results such as blindness, weakness, or failure to move on one side or the other. Now, did you have any questions about the surgery for Mika? No, nothing else you could think of?
Not stuck to my head or something.
And our patient doesn't want to talk to us right now, so he's sleeping from that. The biopsy report just came out now.
Okay.
And as you know from the ultrasound that was done, we know that the kidney was quite swollen. That's usually about 9 centimeters, and it was about 13 centimeters. So there was this saying something's going on there.
Okay.
And so our working diagnosis in the biopsy, this was a rejection rather than infection in the kidney, and the biopsy confirms that.
Okay.
And there are two kinds of changes you see with a rejection. There is a cellular rejection, or there can be a vascular rejection.
Okay.
We are able to reverse cellular rejections fairly well and not very well for vascular rejections, and he's got a cellular rejection.
Okay.
And we'd say that's a relief, right? And it would be considered mild to moderate.
Okay.
The fact that he's a living related donor, one was hoping we might get by unscathed. Well, we didn't.
All right, got it. Yep. Yep.
Kareem, are you
His
there?
mom is being really
Right.
mean to him.
This isn't his
she, in the
usual
dream?
self.
I never see him like that before.
No, and it's all me. I'm feeling really guilty about all this. All these dreams are coming out in the moment. Can I
Hi,
kiss
bud.
you? Don't hurt me. Listen to that, Mommy. Don't hurt me.
Hi, bud.
Well, that was good.
Scary.
Scary but good.
We're gonna go in this room a little bit, right in here, okay? Here, come on this way. Woo! That was not too bad. What the doctors want us to do today is to look at your heart and see how the blood's flowing through your heart, okay? It's a really, really quick test. So all we have to do is one icky part. We have to put a little tiny needle in your arm up here, okay? That's the icky part. After that, it's easy, okay? Alrighty, okay.
Madali yung kagaya noon. Di ba ginawa ka ito?
Now, what I'm gonna do, it's gonna be tighter, sweetie. Good girl. Okay, Mika. You wanna hold Mommy's hand with your other hand, or are you okay? I think it's a good idea. There you go. You're very brave. Ready, sweetie? 1, 2, 3, a little now. What a good girl you are.
Wow, that's the worst part.
And that's the hardest part of the whole test.
Good stuff.
Okay. How's that, okay? Doesn't hurt? Good.
We're just going to undo your buckles because we don't want those buckles showing up in your pictures. We want to see your face.
Okay. Can you flush a bit for me?
All set, Rosie? Okay.
How long does it usually take? I see. If you could let him know, our decision whether surgery goes on or not is dependent on these results. So I have to contact Dr. Nikkanen with the results. Can I give you my pager number?
Hi. Oh, look at her doing all the numbers. She's going all the way up. Good for her. Fantastic. We have the results of that scan, the one where they did the injection in the veins, and that showed us she's getting close to 1.5 to 2 times more blood into her lungs than to her body. So what that means is that she does need the surgery. And what we're trying to do, it's not that she's sick right now, it's not that she's, that anything bad is happening to her right now, but it's a lot easier to do this now than to wait until she's 30 or 40 or 50 years old to do it, when it'll be a really hard operation to do. But I think what you'll see is that overall the risks of something bad happening with surgery are really, really small, less than 1% chance of something bad happening. So that means there's a 99% chance that it'll go through very, very well, and that'll allow her to grow up, have a normal life, and do everything that she normally would as an adult. Okay? I know you were hoping we didn't have to do it.
Really, I'm scared as a mother.
I would be scared too. As a parent, you're bound to be scared.
I pray for the success.
Yeah.
She is very brave.
Yeah.
I'm only the one who is scared, and
I understand.
I'm forward.
I understand. Hopefully it'll be a memory in a couple of weeks. A good memory.
Yes. For the future of Mika. For Mika to be a beautiful lady, healthy lady soon. No?
Right, okay. Now, they proceeded with the biopsy on Saturday.
Right.
And the results of that shows a mild rejection. But what we also see is his kidney function continued to get better with extra fluids. And so I'm favoring that the major component is that he got behind in his fluids. Not his fault, we dictated that. So today his creatinine is good. We're down to 60, and that's pretty good for him. And if it's 60 tomorrow, he can go home.
Okay.
And so maybe we shouldn't take the blood test tomorrow and just send him home, but we'll see.
No blood pressure, no blood test.
Right.
And we'll be fine.
Okay. Once he gets in the home setting, as I was alluding to you, children do so much better.
Oh yeah. I think it'll be really overwhelming when he first comes home. Just with all the things that there is to do, but I think he'll be better off.
Right. You know what? I think you're going to go home tomorrow morning.
Say yes.
You know that?
Yes.
Yes. Does that make you happy? Okay.
You gonna dance? Yeah?
We'll see you tomorrow.
Kareem is discharged the following day.
He's going home. Oh my gosh. Did you do that kiss? Oh my gosh.
Though he will be back for ongoing treatment, the doctors feel Kareem is well enough to go home.
Okay, darling? Yeah.
it's fine.
Yeah, no, I know.
It's too far.
I know. If you wait around there. All right, thank you.
We'll take good care, don't you worry. So watch you come with me and I'll take you to a surgical wing. We'll take good care. But let's stay here and then you can go and have a bite to eat, don't you worry.
Okay. Precisely right then. Have fun.
The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Little Miracles, Alexa's chance to walk and Mika's heart surgery. Six-year-old Mika has arrived from the Philippines with her mother Minda. She has a hole in her heart which requires major surgery. The procedure is unavailable in the Philippines.
Very big gun. Iba ito eh. Hindi Manila ito, naku. This is Toronto. Different, no? So, my daughter is so lucky.
During surgery, a bypass machine allows surgeons to stop Mika's heart as they patch the hole. This procedure involves serious risks.
The main risks involved are to do with the actual bypass machine. A little bit of air can end up being sort of drawn into that tube, or sometimes even a small clot, so the blood can clump together inside that tube. If that clot goes up and travels to the brain, then basically that means the child can have a stroke after surgery, can have results such as blindness, weakness, or failure to move on one side or the other. Now, did you have any questions about the surgery for Mika?
You're being good, head. Look at the baby. Let's stay here and then you can go and have a bite to eat, don't you worry.
No, I'm not as uncovered. My hand 3 times.
3-year-old Alexa has cerebral palsy. She is unable to walk. Doctors will cut 50% of the sensory nerves leading from Alexa's spinal cord. Hopefully, this will lessen her leg's muscle rigidity and improve her chances of walking on her own.
How are you? You say hi to Barbie?
I don't want to see that dog.
You don't? How about you do some games with me instead then right now? Would you like to do that? Sounds good. You know what I get to do? I get to see how strong your legs are. And you can show off to me how you walk.
Oh, yeah.
Do you want to do that? All right. Let's get your feet nice and straight. And you're going to hold Mommy's hands.
The Botox therapy.
Yeah? Oh, when did she do that?
In April.
Wow. And so how many injections did she have?
Just the one.
Okay.
Yeah, I just wanted
So
to see
it
sort
pretty
of,
much should have worn off by now?
Oh, yeah.
Good. Put
your head up.
Very good, sweetie.
Look at Mom.
I like the range you've maintained in her ankles.
Yeah,
That's wonderful.
it's
That will
done.
make such a difference.
It should do. We've been working pretty hard on
That
it.
is fantastic. Can you call to Daddy?
me. You can't catch me.
Don't fall.
Okay. Oh, you're very good at that. Okay, let's go and see how strong those legs are, okay? You know what, sweetie? You know what? We don't have to do it on here. Do you want to go on the couch instead? Come on. Why don't you go to the couch?
Yeah, the thing is,
this is scary. Alexa,
Ever since she had cereal cast.
Hey, listen to me.
I want to go.
You know what? She's just going to check and see how strong
I
you
don't
think you
want
are.
to.
Well, you know what? You have to.
You know what? I'll call your physio, and I'll ask her to tell me what you were doing, and I don't have to do it with you today. Would you like that better? All right? Yeah, I don't need to put her through that.
Okay, that's fine.
I'll get the
Great,
numbers
thank
from
you.
the center. You know, I don't have to do it today. That's fine.
That was close.
It was close, was it?
She looks beautiful here. She's so bright. She's proud. She graduated.
Is she quiet? She
She's
likes to be away.
She likes to be. She's strong.
Yes,
she's very
she is
strong.
very strong. This is the eldest, my eldest son who died.
And you were telling me the day that he passed on was the day you heard that the Herbie Fund was helping Mika.
They when he buried him.
Yes.
The day after burial.
It's beautiful.
Surgeon's not the world's biggest purse string. So looking at the size of the hole, you wouldn't have thought it was that big a deal, but her heart is definitely big. There's a lot of flow going through the pulmonary artery that shouldn't be there.
And it's not so much fixing your legs, it's making them work easier. Okay? Nothing wrong. Yeah, I know. Very cool. Okay, they don't need fixed, right? They need to be helped to work easier.
Yeah, but
right? Yeah. Uh-huh.
Hello. Hi, Alexa.
Yeah, that's a girl.
Do you have any questions about the rhizotomy that we're going to be doing on Monday? She's developing very well and making excellent progress, but this excess tone she has in her lower extremities is really interfering with her getting around, particularly with her walking. And so the rhizotomy operation, which is an operation on the nerves which bring sensation back from the legs, is done on the spine, and basically we divide about 50% of the nerves at each level which are coming into the spine, bringing sensory information to try and reduce the tone in the legs. But in terms of her underlying motor control patterns and her balance and so on, that's not something that this operation really changes.
Okay. Right now it's such a struggle to put one foot in front of the other.
Right.
And so if it's made easier, then the motor control pattern might work a bit smoother.
Yeah, it's not that she doesn't know what she wants to do or can't initiate the right movements. It's just that her legs can't respond because of the increased tone.
Okay.
When will she start doing physio? Like about a week later, kind of thing, or?
No, the physios will come and see her probably the second day after the operation, but they won't be doing very much. They'll just make sure that she doesn't lose any significant amount of range, and she'll still be fairly sore.
Do you think there's a chance that she is going to be able to walk without a walker?
Well, as I think I said to you last time, we don't want to.
Yeah, the whole thing is, putting her through so much.
Right. She appears to us to have all the ingredients for independent walking that we can ask for. But we don't want to do the operation with the idea that this operation is going to make her walk.
Okay, let's go on bypass. Slowly. Open your venous a little more.
Venous line is open.
Okay. Make sure that air goes down.
Venous line is wide open.
Pick up, please. so echo is not always perfect in its measurement. That's it. So the hole is trying to close. We get the air out of the heart so we don't get a stroke. So anytime in the next couple minutes it'll start up. It's a big VSD actually. It's quite big. About 1 centimeter almost. And yes, there it goes. It's got a little air in the coronary, so can you hold that up, please?
So you're in this room here. Okay. Look at this. This is your room. Oh boy. Okay. You ready, kiddo? Yeah, me neither. You all set for today? Nope. You're not all set for today? Nope.
Hi, Alexa. My name's Sheila. How are you today? Look at that big smile. And who's that guy over there? Did you bring him in with you too? What's his name? Does he have a name? What is it? Will you tell me? What is it? Dog.
Jacques.
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 Jacques, the puppy dog? Wow, he sure looks special and cute. All right, first thing we're gonna do is have a listen to your heart. I'm gonna use
Jack's heart.
Should we listen to Jack's heart
Yeah.
first? Okay. Boom, 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 boom. Sounds pretty good. Now what about your heart? Where's your heart? Do you know? Is your heart down here in your knee?
No.
No.
Right there.
It's right there?
Yeah.
I'm gonna have a listen, okay? Might be a little bit cold. How's that? Is it okay? Let's have a listen.
Yeah, sounds good. Yeah. Hear a difference? Yeah. 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 She's doing really well, and her heart sounds good, and her heart rate and blood pressure have been really good overnight. And you know, she's doing so well right now. Maybe she'll be able to go upstairs today to the cardiology floor and leave the intensive care unit. That'd be nice, wouldn't it? Yeah.
I haven't gotten there.
Yeah. So that's great that she's done so well.
You tell your papa that Bika is now okay. You just tell to him na that Bika is okay. Yes? Oh, sige, bye-bye. Okay.
Okay, Peanut.
I can't put my eye.
What's that?
I'm waiting.
Pardon?
Are we ready to go?
Okay. Yeah.
So Mom's gonna walk you to the door, okay? And then I'll take you, and then we'll go to our special room. And Mom's gonna wait in another special room. All right, you ready?
You got Pikachu?
You have to teach me that name.
Okay.
She'll be waiting, my angel. Let's go, precious. Let's go. They're waiting, honey, okay? Please be ready. Say see you later. Say see you later.
Look. Here we are.
And Dr. Drake has allowed about 4.5 hours.
That's right.
For the surgery. And Dr. Drake will come and see you here at the end of the surgery. Okay. Did you get any lunch?
Didn't even eat breakfast, though.
Didn't you? Would you like to go down and get something to eat right
Yeah,
now?
I think we probably will. Yeah.
Good idea. Okay.
Orange.
Whoa.
Do you like that smell? Is that okay?
Let's lie down when you're done. So let's lie down
Put
on
your
the
head there
jello.
for me.
Lie down on the jello.
Very good, Alexa. Very good.
Just mostly the legs. Her arms are hardly involved at all. And she's very coordinated.
That's
I mean,
the faith, though, isn't it? When this is available.
yeah, I mean, it's so easy to do this, right? And you don't need a fancy stimulator. You can just. Okay, here you go, Maria. Okay, L3. Yeah, there it is there.
I'm getting variation.
Oh, okay. Okay, S2 motor.
Ready, Maria? You're on?
Yep.
Definitely.
Okay, any bladder or?
None.
None. Okay, just cut this one. Okay, Maria, we're all done. Thank you. Yep.
Good.
Good?
Yep.
Anything else?
No. You're sharing the raid first with William, so.
Okay. So you're right, we can see Alexa?
We can go in, eh?
We can go in?
Yeah.
Thanks, Mom. Okay, baby.
Oh, ikaw hawakan ko tapos anohin mo yung ano. Oh, sige. Ilan na yon? 3.
Basically, she's done perfectly from the surgery. Everything went just according to plan. And even though the VSD was a reasonable size, it was closed with no complications. And if everything's fine, then you'll follow up with Dr. McKinnon in another couple of weeks before you go back to the Philippines, right? Okie doke. We will see you later.
Thank you, Doctor. Thank
Okay.
you, sabihin mo na, Doctor.
Bye, Mika.
Bye, sabihin mo naman,
Okay, Alexa, I'm going to show you what we're going to do. Is this shock? Yeah, okay. See how he has his 4 little legs here? Okay, they're kind of like your legs. So what we're going to do with Jacques is we're just going to give him a stretch like this and move his leg back. Alexa, can you show me on Jacques? Wiggle your toes.
Yeah, she's upset. It's just, every touch she associates with pain at this point.
1, I'm going to count to 10. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, sweetie. Okay. I'll take a break.
Okay. That's how it's done. That's how it's done. But you know what? You're going to get too stiff if you don't do some stretches, Alexa. All right? You know what Vivian said? You want to be able to ride your bike next week? I know. We're going to leave you alone in just a couple more minutes.
Mika came over from the Philippines and had on November 3rd an operation at the Hospital of Sick Children. And as you can all see, she's just doing wonderfully. She had a 5-hour operation that I hear within 2 days she was up and laughing. And the most wonderful part of it is that through the funds raised by Operation Herbie, we were able to bring her over and have an operation that just wasn't available in her home country.
I thank you so much, I appreciate very much for this help you have extended to my daughter. And we will go back home to our country with much joy for this. And We will always remember forever what you have extended to us. Thank you so much. Thank you.
Mika made a full recovery from heart surgery and returned strong and healthy to the Philippines with her mother.
Okay, where's Daddy gone? Oh, there he comes. Over there. Over there.
Oh, I can't believe it. I can't even believe how much looser her legs feel, and just yeah, she feels so different. It's great.
Wow. Okay. One more stretch. Okay, sweetie. Here we go.
My finger's stuck in there. My finger's stuck. Oh, give me my finger back. Where'd it go?
All right, Alexa, look at that. Look at that leg move.
Give me that. Is he mine? He is.
Good girl.
Get your knees bent and show your friends how you can stand up. Ready?
And I'll show you exactly.
Whoa, are you ever tall? Let's see here. Look at you standing on your own already.
Alexa goes to a school at the Bloorview Macmillan Center that attends to her special needs.
Alexa, we ready now to go to your bicycle and then to therapy? All right, let's go stepping along. And you are doing so well that I'm sure that in the next few weeks we're going to see you walking.
Her intensive physiotherapy continues, and her walking improves daily.
Few more steps, you're nearly at the bicycle.
Look at how good she's doing. Holy God.
Her parents remain hopeful that she will soon walk on her own. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Little Miracles, the birth of baby Evan, and Kayla visits the ER. Megan Groves and her husband Adam are on their way to give birth to their first child. At 4 months, an ultrasound detected the baby's bowel was developing outside his body. After labor is induced at Mount Sinai Hospital, the baby will immediately be transferred to the Hospital for Sick Children for emergency surgery. 20 hours later, Megan has given birth to a baby boy. The baby's bowel is protruding through an opening in his abdominal wall. He is transported to the Hospital for Sick Children through an underground tunnel. His mother must remain in recovery at Mount Sinai Hospital until morning.
Okay, buddy. Over here for a while.
If surgeons cannot place the bowel within the baby's abdomen, he will not survive.
Oh, wait, can I get you a chair?
No.
Okay. If you want this one here, you can sit
You did? Mm-hmm. Hi. Paul Wills, I'm a surgical fellow with Dr. Bechtel. Oh. Congratulations. Thank you.
What they're going to do is they're going to soak it and they're cleaning it. They're looking to see if there's anything wrong with the bowel, and then they're going to wrap it back up before they decide what they're going to do. Because that's their small intestines. They just want to see how much is out and what is affected.
8-year-old Kayla has been bitten by a dog. Police called to the scene have escorted her to the ER.
Honey, you're knocked into the gas mask. No, I want the gas mask. Okay, fine, we'll get the gas mask, okay?
You ask the nurse.
Ask the nurse.
They know the
About
best.
the dog, honey. Does the dog have all shots? According to information we've seen, yes.
The dog rushed up to greet the kids, and within a matter of seconds, one of the counselors heard a growl, and the girl was screaming.
The dog probably got really nervous with a lot of kids around.
Why did it have to bite me?
Well, it's their reaction. They get scared, they get nervous. You like it?
Hello.
Can you put a gas mask on me? I've never been here.
Yeah, a gas mask. I don't know the gas mask, like the little face masks?
Yeah, that put you to sleep?
Oh, those. Oh, we won't talk about that yet. Are you okay? A bit frightened? Yeah, well, don't worry. We're gonna look after you. You're gonna be just fine. It's okay. How's your eye? Are they okay?
Good, it didn't touch the eye.
Didn't touch you. That was lucky, wasn't it? Yeah.
I'm very lucky.
Just look over here, Kayla. Just look at the light. That's good. I'm just gonna pull this down a bit. Try not to hurt you. Good. Okay, your eyes look good. Okay.
It's very close, like right here. It's very close.
Yeah. There's 2 cuts there, you know?
I know.
You know that, and we're going to do that.
Where it bit.
Yeah. And what we're going to do is we're going to get another doctor in here, okay, who does a lot of the fixing up for cuts, okay? They're called plastic surgeons, okay? And they're going to come and have a chat with you very soon and get this whole thing sorted out. All right? Do you have any questions?
Are you going to put the gas mask on me?
Well, I don't know that. I'm going to ask the surgeon who comes. But don't worry, what they're going to do is they're going to give you something so you're not going to feel anything, all right? You're very brave. There are 2 deep cuts on the face, and that's going to require a plastic surgeon to come down and fix it up so that we get a nice result. The other issue is the possibility of infection, and that's not rabies, that's something else, just the bacteria in the dog's mouth. So Kayla's going to have to go on some antibiotics. Okay?
Okay, great.
Okay.
Thanks.
Okay.
Still haven't answered my question.
I don't think you're going to get gas, Kayla. You don't need gas.
It's the gas mask.
The
It puts you to sleep.
They don't need to put you to sleep.
But I don't want to.
If you're not going to feel it, why put you to sleep? So you'll be fine. No. Well, you keep telling yourself it's not going to be fine.
Yeah, 'cause it won't.
There's quite a bit of bowel out, so I don't think we'll be able safely to put everything back in tonight. So we'll try to just push the bowel gently back in a little bit at a time every day. We'll stretch the baby's belly also to try to make more space for everything else to come down.
Okay.
After a couple of 5 to 10 days, we'll put everything back in and then close the belly and then wait. So there's a certain amount of time by which we have to get the bowel in.
How long is she going to be in surgery for?
Well, it probably is going to take half an hour before we get into surgery. The surgery will probably be like an hour and a half. Have you decided on the first name or?
No.
No, not yet.
Hello? Hi. You awake? Oh, good. Well, I'm just over here at Sick Kids, and so they've done their examination of him, and she says that the opening is fairly small, but Dr. Facto, and she said that the opening is fairly small, but there's a fair amount of bowel out, so she figures they're gonna put a silo on it, and she figures it'll be like 5 or 10 days before they can, before it's in. Yeah, he's still got 10 fingers and 10 toes. So, no, he's, well, they're prepping him for surgery. Okay, we'll talk to you later. Alright, bye. get daddy's gin or mommy's gin?
And when he comes back from the OR, he will get a morphine infusion because you can imagine with the bowel that's been exposed and having to manipulate the gut and to have to put that back in, it's going to be awfully horrendous for him.
Yeah, that was one of the things that was bothering Mummy.
She's entitled.
Yeah.
You know, you expect a normal baby, and this is, you know, this isn't normal for them. Okay, I'm just gonna close him up here so he stays nice and warm. And I'm gonna go up just if you want to come with us, Dad, and I'll show you where the waiting room is. Okay. Hey, Daddy.
Buddy.
Nice big kiss there. Yeah. We'll take good care of him for you, okay?
Okay.
Hey, Kayla.
Hello.
Hi, hon. But you know what, hon? I just need to take a look at your hand, okay?
Oh, my hand.
Yep. Well, not that one. Let me take a look at this one, okay?
Why, nothing happened here.
No, I know, but you know, we're going to give you some medicine, okay?
What's that for?
Take a little band, help me see your veins better.
You're doing it tight?
Yeah. But you know what? It's very quick, 1-2 seconds, and that's it.
Honey, remember the dentist? Yeah, I know, but remember the dentist? Remember you went hysterical and it didn't even hurt. Lie down, relax, let's get it over with. Remember the dentist, honey?
I want you to put me to sleep, though. I want you to put the gas mask on me because I've never been here. It's freaking me out.
And just think, this isn't going to hurt nearly as much as the dog bite, right?
We're going to lie her down, and Mom and Norma to leave.
I said I wanted a hug, that's all.
Just come because then for the next really bad thing you'll be allowed to stay. Yeah.
Don't fight us.
It's just a needle. Phil, it's going to be just
like having a vaccine.
Wait, hold me as tight as you can, everybody. As tight.
Do your best not to fight.
As tight as you can.
Okay.
As tight. I'm gonna move.
Well, don't try not
I'm
to.
gonna squirm a lot.
When you feel the pinch, you blow
Good girl.
It's
all done. Good girl.
Y'all worked up for nothing.
But it didn't even hurt at all.
Well, there.
So how you know?
Everybody was trying
Does that mean you want another one?
No.
No, we're just kidding,
Okay.
sweetheart.
I was hoping maybe we could get her something to sedate her a bit. So I'm not sure whether you want to just do some oral midazolam or.
Was she given anything to start with for pain? Or
No, she's not in a lot of pain. It's anxiety. It's not a pain issue. She's
Okay.
really highly anxious.
Okay. Hello. I'm gonna touch the wound there, and if it hurts,
Ow.
You're being very brave.
At the top it hurts, but down here it doesn't hurt at all.
Okay.
Down here I don't feel it at all.
she's got 2 penetrating wounds, and a big, but they're right next to her eye. And if you happen to be injecting some local or irrigating, you might just plunge into her eyeball, and that'll be it.
Okay, so what's the solution?
So the solution is to put her to sleep.
Oh, she'll be happy about that.
Okay?
All right, have you got the...
You want to stretch the belly a little bit? Over here. So we're stretching the belly because there's no space in that belly. It's never seen the bowel in. There's what we call a loss of domain here.
What is it, 1 in 20,000?
Yeah.
No, this is the hard part.
Beautiful.
Isn't that nice? And over the next week or so, squeeze it in like that. There you go. Okay, that's it. Done.
Kayla, my name is Jengus. I'm one of the anesthesiologists. Dr. Fisher here and I are working together, okay, kiddo? We've heard all about you. Let me tell you what we're going to do, okay? We're going to go into the room very soon. We are going to pick you up gently and put you over onto another funny-looking table.
I can walk.
Okay, well, you can do it yourself then. We're gonna give you a little bit of medication through that intravenous, okay? It won't hurt, no more owies. That's right. And you have a little snooze, okay?
That's what I wanted, you guys to put me to sleep.
Well, she'll be fine, we'll take good care of her.
It's a good feeling, honey.
Okay, away we go.
Mom, she has a belt.
Fair warning,
Yeah, I
she
saw
talks
that.
in her,
That's nice.
She talks in her sleep as well.
I don't.
No kidding.
Yeah, you do.
Aww.
Hi. We're all done, okay? Everything went well.
Okay.
We put that silo around the bowel, as I said, and slipped it just underneath the belly wall. His bowel is still kind of soft. Pliable, so I think things will fall back in easily. Okay?
Yeah.
So he should be back up here in about 15 minutes.
Okay.
Okay?
Hi, buddy.
He's got his eyes open.
Mm-hmm.
Who's Daddy?
Cute. Poor little guy. Very cute.
Have any questions? Kelly can answer them for you, okay?
Okay.
All right.
Only 46, yeah.
And we went to camp, and I was between two sleepwalkers.
Here we are, kiddo. Watch out for that bump in the middle. I want you to come right across here, okay?
Hey, Bookie.
Okay, kiddo, can you lay down now?
Here for now. Oh, well, I usually sleep like this.
Kayla, now you have to listen to us, okay?
You know, are you gonna wait until I fall asleep to do the surgery?
Oh, yeah, definitely.
Okay, do I pull my shirt up?
No.
What are you doing?
You're going to be asleep before you know it.
Are they gonna poke a needle through?
Kayla,
Yeah, for now.
we're going to be getting you off to sleep, okay?
Okay.
So
Will it
think-
hurt?
Now, Kayla, just put your head right down. Put your head right down.
You're gonna feel yourself
It
settling
hurts.
off to sleep.
It hurts.
Are you doing
It
fine?
hurts.
Okay, you're doing fine. It's gonna be over in just a second.
That's it, cutie. Good for you.
Evan? Evan's nice.
Yeah? You like that?
Yeah.
You don't care me.
No, he doesn't care what his name is right now. When he's a teenager, he'll hate you no matter what your name is.
Things are looking good.
Are they?
Some progress here. Well, if you consider we started here,
Okay.
started, you know, about here, down to there.
Get the feeling it wants to push up, eh?
Yeah.
Do you think that's enough?
I don't think this will give.
No, but I mean, do you want to try to push it more?
Oh,
We pushed a lot more back in today, so hopefully by tomorrow we'll be able to push it all back in and then go zero.
You're okay. Yeah, that's better. You're a good boy. Yeah.
Much happier now.
Yeah. Oh, that's better. Oh.
pretty close to her eye. She's lucky. It would have been cruel to do this in the emergency.
Yeah, but,
Deep, eh? Nasty. Really just a lot of irrigation. The goal here is really just to clean things up. Fairly loose to allow for fluid egress. It's a curvilinear scar, and when wounds contract, and we won't repair this as nicely as we would a surgical incision.
Thank you.
There she is. Hi, sweetie. How you doing?
It's okay.
It looks really good.
You see? Look at Daddy.
Very good.
Oh, yeah.
Very good, sweetie. All clean. Remember where it was the
Very lucky.
the bite?
Very, very lucky.
It's a little line right now.
Here comes Amir.
Wow. But it looks like they did a nice job. It's all fixed up.
Still look pretty.
No, don't be so upset about it. It'll be fine.
Okay, so why don't you lie back on your flat on your back? Scared.
But can they put me to sleep?
Nope. Here's the deal. When you tell me to stop, I promise I will stop. Okay? I promise. Okay? You trust me? You ready?
She'll stop when you say stop. Just do the thing. Tickle.
Ow! Ow! Ow!
That's one.
You said you would stop.
You didn't say stop
didn't
yet.
say
You just
stop.
said ow.
Okay,
So
now
I
there's
think I'm
one
bidding
left,
high.
and this is right near your eye.
It's all over.
So you need
Cool.
to be really still for this one.
You'll be
okay?
fine because you're pretty brave. Right?
Very
Close
still.
my eye.
Yeah, that's a good idea.
You've been so good about getting this stuff cleaned and washed and everything. It's been really cool.
Done.
Wow, that was very good, Kayla.
Thank you very much.
See ya.
See ya.
Don't forget you again.
After 8 days, Evan has had a setback. His abdominal muscles have pushed his entire bowel back out of his body, undoing doctors' efforts.
Well, I think what happened yesterday is with the stretching, stuffing things back in, the hole in his abdominal wall is getting stretched out, right?
Okay.
Basically, we're back to square one, right?
Yes, we are.
Baby Evan is now 9 days old and time is running short. Doctors must find another way to encase the bowel and close the abdomen in the next few days. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Little Miracles, Ashley faces surgery, and baby Evan's struggle continues. "9 days ago, Megan and Adam Groves gave birth to their first child. Baby Evan's bowel had developed outside his abdomen. His body was too small to fit the bowel inside. Hours after birth, Evan had emergency surgery to place his bowel in a plastic pouch called a silo. Over the last week, doctors gradually pushed the bowel into his body. Now Evan has had a setback. His abdominal muscles have pushed his entire bowel back outside.
Basically, we're back to square one, right? Yes, we are.
Time is running short. Evan's condition will deteriorate if doctors do not encase the bowel in the next few days. They must perform the surgery to close Evan's abdomen or risk infection. They will temporarily paralyze his body so he cannot push back against their efforts.
It's time for me to go. I don't want to see him squirm too much.
Yeah, it's not comfortable.
Yeah.
Hang on.
'Such a good boy.
"11-year-old Ashley Fortier was born with spina bifida. Her spine is poorly developed, and she is paralyzed from the waist down. Now Ashley has developed scoliosis. Her spine is twisting to the side. Without surgery, the scoliosis will become debilitating. Ashley will experience difficulty breathing and increased pain.
You know what? You're old enough now that you can start talking and asking questions for yourself. We can be there with you when you ask, but it's important that you learn to ask the questions that you want for yourself, okay?
Okay.
In 2 days, Ashley faces a 12-hour surgery. Doctors hope to straighten her body and relieve her pain.
But sometimes when you know what they're going to do to you, you're not so scared. I don't blame you. I'd be nervous a little bit too.
You know how nervous I am right now?
Yes, I know how nervous you are right now.
That's how nervous I don't want to be.
So normally the back should be pretty much perfectly straight, and you can see how crooked your back is through there. Now, when
It's
you
like an S.
It's like an S, that's exactly right. And given that the curvature has progressed so rapidly over the past couple of years, gone from about 50 degrees, the last time we measured it was about 100 degrees. Now she would have even more difficulty sitting, because I think with the curvature she would become more off balance, she would become more obviously crooked. The first part of the procedure is done from the side of the spine, and there's a little vertebra there, a block, of which I'll need to remove partially part of that block in order to allow the curve to be corrected. And then with you perfectly asleep, she's put in a different position, and then the rod goes in the back from the top of her spine down to the bottom.
Okay. I won't have that much pain.
No, not much pain.
Like I have been.
Yeah, like you have been.
Yeah, your back hopefully will be much less painful than it is now. There's something that we can give her which would make her feel very relaxed.
It's not going to have to be put through an IV, is it?
No.
Okay,
No,
so
it's
the
great
IV
stuff.
could be given to her when
Yeah,
she's
afterwards.
asleep?
Yeah, pretty much asleep. So she would get this stuff that she would take by mouth, and I think it's chocolate, I think is the flavor. And it would make you feel quite relaxed, because I have a feeling when she gets there Wednesday
I
morning.
won't get nervous.
You won't? You're planning not to get nervous? Everything's
No.
going to be fine?
Okay, I am going to roll the bed down. Need it, guys. It's hard to see him like that, eh? Knowing he's gonna be like that for a couple days. You hate to keep them like that. Has multiple advantages, being paralyzed. You want to squeeze enough of the tape? right?
I don't think this will give.
All right, that's probably enough for today. Tomorrow we'll be able to get it all back in. Okay, fitted, paralyzed, and we got it halfway back in. So I think tomorrow we'll be able to do the other half. See, it's much easier when he's not struggling against us, right?
Does it seem like there's a lot of room left for tomorrow, or?
I just don't want to do too much and then have the thing pop out again.
Yeah.
Well, we'll try to get it as fresh as possible. So we'll do this again tomorrow, and if we can get it all in tomorrow, then we'll plan for surgery on Saturday. All right?
Okay, thank you.
Sounds good. All right,
Thanks.
bye. There's a lot in now. He hates this thing too, so it's a good thing he's out.
There we go. X-ray time.
Yeah.
Okay.
You can handle that, eh?
Yeah.
Yeah.
And then on Wednesday we have the surgery. And then Thursday I have to stay in the hospital.
Well, you'll be in the hospital for a while.
Not that long.
A while, you know that.
But Mom, I don't have any friends around here.
You're gonna meet some.
Yeah, but I want to be able to move and play.
I'll tell you everything we're going to do. Everything's going to be just fine.
Stretch your legs?
Yeah.
Well, that's pretty much what we're gonna do. I'm gonna stretch your legs,
It's
and
not
he's
gonna hurt.
No.
What's gonna happen?
Nothing's
It's
going to
an
happen.
X-ray. We're just
It's
gonna
going to do an
straighten
X-ray,
you
just like an
out.
X-ray, you
Oh,
know?
it's just like this?
Yeah, just like
we're
that.
straightening you out. He's
scared.
just gonna
No,
hold your
nothing's going to happen.
shoulders
Nothing's
straight.
going to happen. Everything's
Oh, you're just holding me?
You know what we're
Yeah,
doing?
I'm just going to hold
We're
you.
straightening you out.
Yeah.
Actually, okay? Tell me when.
There we go.
No.
No.
I'm scared for nothing.
Scared for nothing.
I even know what the doctors
Help
I never had my leg that straight before.
No, eh?
Never. Never, eh, Mom?
No.
Never?
No.
Never will?
Never, never will.
I wish they could.
Yeah.
Fix it to make it straight.
Guess what?
What?
We're just gonna send you downstairs for some pictures
What do you mean?
to get some pictures done.
X-rays?
No, just like photograph pictures, okay?
Photograph?
Yeah, you know how you take a picture with a camera?
Yeah.
Same thing. And then a little bit of blood work and you're all done.
Blood work? No. I don't want any blood work. Mommy, I don't feel well.
Okay, not better?
Maybe let her get some fresh air.
I want to go home.
You want to get some fresh air?
Yeah, I want to go home.
Okay, you can only go for a few minutes though.
You don't care, you just wanted to get out of there, right?
Yeah. I want to go home. I want to go home.
It's gonna take just a couple minutes and they're gonna do it right there.
Yeah, no. I'm just saying, I'm nervous. Can you do it on my foot, please?
You shouldn't be nervous on your foot.
Hmm?
You shouldn't be nervous on your foot.
I want them to do it.
Hey?
I want them to do it there.
Well, that's where they're gonna do it.
Yeah?
You did last time, right?
Right?
Right. Well, there you go. No problem.
Sweetie, you're doing good,
done?
honey. You know what? The drops are just moving slow.
Oh my starlets!
What happened?
It just started coming
Just
like
rubbing.
gushing.
I guess it's working.
You happy you did it now?
Mm-hmm.
Doesn't matter. Okay, my dear, taking it out, and you know what?
I won't feel it, so don't worry.
You're so shaky, eh?
I'm so
You were
shaky.
so nervous about this, weren't you?
Yeah, I was.
Oh, you did good. Don't worry.
You can just make sure his line is all secure.
Do you want to take the whole nest?
Yeah, I'm gonna
It's
take the
easier.
whole nest. So I'll lift him.
Ready?
Yeah.
Hi. Hi. So what we're going to do is we're going to take off the silo, and what we'll try to do is reapproximate as much the muscle as we can. And if we can't reapproximate the muscle all the way, then we'll just close the skin over it. Okay. And then we might keep him on antibiotics for a few days after the surgery. Okay? Yeah. So I'll come and talk to you in the parents' waiting room, just beside you, as soon as we're done. Okay? We'll be there.
We'll see you in a little while.
Okay.
So I'll look in when I'm on my way down.
Okay.
You know.
Thanks.
Okay.
Maybe we should have let you sleep in a little longer, eh?
Yeah. Don't want to in the operation.
A little less than 2 hours. Getting anxious there, eh?
Mhm.
Get this done, over with.
Yeah.
Get your back all fixed up. Go home. Show everybody you can do wheelies on your wheelchair.
Yeah.
Yeah.
There he
is. There's the guy.
Morning, how are you?
Good, sir.
Good? You don't look kind of anxious. Are you okay? Is she at least a bit anxious? We can give her some medication.
As long as it doesn't taste bad, fine.
Well, it's chocolate, but it's not Swiss chocolate, okay?
Ready? 1, 2, and.
We'll
Drink the
surprise
water.
Dr. Roy.
Drink the water.
That's it. It's okay.
No, that's
Okay.
fine.
Good
I want you to breathe
job.
slow and out.
Good job.
And slow.
In your nose.
And out.
Oh, is that a good test?
Everything she said and more, right?
Is it okay?
I just got feel a little bit nauseous.
Okay. Here's the silo. Okay. So, all right. So what we'll do is we'll put maybe 3 stitches on this side. Right there. We're starting to close the belly, so if it's ventilation is getting more difficult, let us know.
Picture of him
Well, we
is.
did some.
There's a good picture of him, and the one, the kid we've been looking at for the last 2 days. It's not
No,
the same.
well, you can't equate that.
You're just the
these
cutest
ones
thing.
are all.
You just are the cutest thing.
I can't wait to get him back.
This will become easy. Yeah. That's fine. He might have a hernia, but it's not worth taking the risk of shutting down his kidneys or making him difficult to ventilate, so it's tight. I've pushed harder though.
I'm gonna give you a big hug when I.
No, I'm gonna give you a big hug.
No, I am. Gonna
No,
give you a hug.
I'm gonna give you a bigger hug. Getting tired now?
Yeah.
Want to take your glasses off?
Yeah.
That's good though. Makes you calm.
At least now you'll be nice and relaxed when you go in.
Yeah.
Okay.
Why did it from my bed?
Well, they're bringing you.
This is a special bed, okay? It's on wheels, so we can take it places. Okay, sweetie pie?
Okay. Love you. I love you.
Bye. Big kiss.
Bye, darling.
Does she want to see the parents in the recovery room? Sleeper in the parents' waiting room.
Big breaths for us. I'm scared. We're right here. We're right here. It's okay to be scared. We're right here, though. Okay, all right.
Okay. Just go for it.
Can you stick with me?
Yes, I'm right here. You want to hang on to my hand? Right here.
All right, sweetheart? Okay.
Is she coming in?
There she is. All done. Everything went well. We're able to close, I would say, 3/4 of his muscle. So that's pretty good. So he's left with about a centimeter in the middle that we couldn't get. Well, we could have gotten the muscle together, but with a lot of tension on it, and he's getting a little tight. And then we close the skin, and there's no problem. So all you see now is little white tapes, and then a film of plastic, and everything.
On top of his skin.
On top of his skin. And everything should fall off on their own.
So that's it?
Mm-hmm.
Oh, wow.
All back in one piece.
Wow.
Yeah, I'm happy.
Those are happy tears.
Yeah.
They're the best kind.
Yeah. Hi, Evan. Oh, look at you. You okay? Oh, sweetheart, you look wonderful. You got a real tummy. Okay. Well, tough 11 days, hasn't it?
Not long now before we get to hold him.
No. Maybe.
Ashley figures that I should have a blanket done by the time we leave.
You probably will.
Well, I did one the last time she went for surgery, so.
So this is the anterior part of the spine, exposed, and all the little bumps represent the discs in between the blocks. Pretty stiff, eh? Jump into Hosevitz, that's stiff. The spine is quite rigid. It's not moving very much at this stage. We'd like to see if the vertebrae are starting to move a little bit, but it's quite stiff, which suggests we may not be able to get it much straightening as we would like.
Evan is now 1 month old. His bowel is healthy and he can process food without an intravenous. His surgery and recovery have been a complete success. Today, Megan and Adam can take their son home.
Takes two of us to dress him, eh?
Well, for now.
We're new at this.
Yeah. This thing's huge.
Yeah, Mom.
Oh, you're handsome. You're handsome now. Yeah. Oh, be quiet. Daddy's gonna put the stupid hat on you.
It's his hat.
Oh, there's his head.
Bye. Bye-bye. Okay, take care. Yeah, bye-bye. Thank you. Great.
Okay, now we get to try and put the rod in. Again, the implication is that we won't get as much correction as we're hoping. We're hoping to make her quite a bit straighter, and we may have to accept her not getting any worse. Okay, now we'll take the rod cutter.
Ashley has been in surgery for 8 hours. Her spine is in worse condition than doctors had hoped. They will continue to insert the metal rods. Only then will they be able to determine if they can straighten her body and relieve her pain.